It's a challenging journey. Oftentimes our patients are misdiagnosed for many years, but once they are diagnosed, the good news is there's therapies that are in the pipeline and there's therapies that are available now. There's some new therapies coming, which we're really excited about. And so they can live a long and fruitful life.
We're here with Scott Santarella, CEO of Alpha-1 Foundation, and we just got a few questions for you today.
Happy to answer them.
So when you are advocating and you are on the Hill, you're advocating with the community, how do you describe the mission of Alpha-1?
So the mission of the Alpha-1 Foundation is to find a cure. And in addition to that, along the way, is to make sure that we're servicing the patients and providing them the programs and the needs that they have to survive their journey.
When we talk about the patients with Alpha-1, how would you describe their journey and what's really important to them?
It's a challenging journey. Oftentimes our patients are misdiagnosed for many years. And they also get misdiagnosed with COPD, so we've got a challenge there. Right. But once they are diagnosed, the good news is there's therapies that are in the pipeline and there's therapies that are available now, plasma-based therapies. There's some new therapies coming, which we're really excited about. And so they can live a long and fruitful life, but they need to be diagnosed earlier and they need to get on a treatment plan as fast as possible. And oftentimes they need to see an expert. And that's one of the challenges in rare diseases. There's not a lot of experts out there. So we're an organization that provides access to those experts.
And when you think about all the resources that you provide that can be provided from industry, from the healthcare community, what are the most important things we can do to support the everyday life?
You know, I think it's supporting our educational programs, supporting our awareness programs. For us, it's the more knowledge that we can impart to our community and our patients. An empowered patient is a patient that survives longer. So education is important. I think access to care is really important too. So all the programs we have, oxygen programs, care through Medicaid and Medicare, policy efforts, right? Anything that has to do with the work that we do in the policy arena to make sure that we're ensuring that there's access to care for patients is really important to us. And having industry partners that support those efforts is really important.
What do you think from a policy perspective that has to be done, whether in DC or at the state level, to support the community?
I think making sure that there's access to care. I think cost containment is another big issue. And really, you know, improving the overall testing and detection of the disease is really important. And anything that we can do to make sure that state level policymakers and our federal policymakers are supportive of those types of issues, we can move the field forward on behalf of patients.
What gives you hope that we're going in the right direction?
I say this all the time. I grew up in the oncology world. I feel like the Alpha-1 Foundation and the Alpha-1 community is where cancer was 20 years ago. We're on the cusp of some incredible breakthroughs, and we're on the cusp of, I think, advancing the field in ways that are going to transform people's lives. And it's really exciting to be a part of that.
Scott, it was a pleasure. Thank you very much.
Thank you, Duane.